Welcome to the IBS Nutrition Podcast, your go-to source for navigating the complex diagnosis of irritable bowel syndrome. Here, we dive deep into IBS and discover the power of diet and lifestyle to find freedom from your IBS symptoms. I'm your host, Jessie Wong, FODMAP dietitian and a gut expert. For years, I suffered from debilitating gut symptoms that kept me out of work, feeling constant discomfort in my body and anxious around food. Today, I'm in control of my IBS, able to eat the food I love again, travel whenever I want, and spend quality time with loved ones. It is my mission to help you do the same and transform the way you live with IBS. Let's get started. Hi, everyone. Welcome to another episode of the IBS Nutrition Podcast. Today, I have a very special guest here with me, and that is Dr. Ellie Navidi, who is a licensed clinical psychologist and one of the founders of GI Psychology, a multi-state center specializing in helping patients with GI disorder and chronic pain. Dr. Navidi oversees training and outreach at the practice. He is one of the founders and past president of the Northern Virginia Society of Clinical Hypnosis and a hypnosis trainer for ISSTD. Welcome, Dr. Navidi. I'm so happy to have you here.
Oh, thank you so much, Jessie. It's a pleasure to be here. And, we've kind of run into each other over the years. So I'm glad that we had a chance to do this.
Yes. And I remember, I think, multiple different GI conferences, right, that we've met and talked and really knew each other for a few years now and working together in this space. Yes. Oh, now, I have a few topics that we would like to talk about today. So one is explaining the gut-brain connection and how it plays a role in IBS or functional gut disorders. There are so many confusing theories about the gut-brain interaction and disorders of the gut-brain interaction online. So having a doctor in this area, a psychologist in this area, can really help us explain better what it is and maybe debunk some myths that we hear online all the time too. So that's topic number one. Topic number two is when to seek GI psych help. Because we know it is extremely helpful for patients, but not all patients understand that they may benefit from going to a psychologist that specializes in gut disorders. So let's talk about that. And number three is, what do treatments look like when working with a GI psychologist? And last but not least, topic number four will be Dr. Navidi sharing three actionable steps for our listeners so that you can take it home. And these are actionable steps that you can use right away to help ease some of your IBS symptoms. So I'm very excited. Let's dive into topic number one. Let's talk about what is the gut-brain connection and how it plays a role in IBS and other functional GI disorders.
Perfect. So I think the thing to understand is something you already mentioned earlier, which are disorders of gut-brain interaction. And for people who are listening who don't know, that's a broad category of different disorders that include irritable bowel syndrome, so IBS. And what we're talking about are these disorders where they can't find any structural problems. So they can't find inflammation, there's no cancer, or there's nothing they're finding, but the symptoms are very real and they can be very intense and debilitating. So it can be very confusing what is happening here, because a lot of patients get disappointed. They get tested, they get scanned, they get blood. It could go on for years and they don't find anything. So then they start feeling, kind of shamed and feel bad, but they absolutely shouldn't, because it's not just in their head. They're not crazy. There's a real, true disorder happening here, but what's causing it is the interaction between the nervous system and the brain and the gut. And that's where we talk about this gut-brain connection or the gut-brain axis, right? And I don't like to get overly technical about this. I think a lot of people will start talking about the vagus nerve and serotonin and this is like enteric nervous system. Like, no, I don't think that's necessary. We're not writing a dissertation here. We're not like doing something fancy. I think that people just need to understand that there's a special connection between the brain and the gut. And what that means is that what happens up here affects what happens down here. And what happens down here affects what's happening up here. And so I think that is at the minimum what they need to understand. And then we can start looking at what I like to think of as the model for these disorders. So the model for IBS. And I know I've been talking a lot without letting you talk so far. So I'll pause for a second. And just,
Well, I want to recap on what you were saying.
Yeah.
It's not in your head, right? I think a lot of the times our patients go to their providers getting all the tests done, which is great and very necessary to
Yeah.
test out other conditions because all GI conditions have very similar symptoms. So it's important to distinguish your symptoms with IBS compared to other disorders.
Yes.
But it's not in people's head because
No.
there is pain, there's bloating, and sometimes distension. These are physical and visible symptoms, and people have to deal with them. And oftentimes it's very debilitating. And when they hear that all the tests are normal, it's just IBS, and people feel like their doctors are saying, well, it's just in your head. Now go and learn to manage it because nothing is wrong. I can't do anything for you. That's not true at all. And thank you for saying that and validating what our patients experience. Yes.
I like to talk to people about a computer, right?
Mm-hmm.
So imagine that you go to use your computer and it's just not working, right? And you do this and you do that, and it's just not working. So one thing you might do is you might like check the actual hardware. Is everything plugged in? Are the monitors working? Is the CPU, like checking all the hardware? And if the hardware is fine, that doesn't mean your computer's still not working. Your computer's still not working, but the problem might be with the software, right? There might be one program that's interfering with another program, or one program's malfunctioning somehow. So I think of IBS as a problem with software. And just because it's a software problem, your computer still isn't working. There's still a serious problem happening. It's just what is causing the problem is different than if there was a hardware problem.
I love this energy.
Analogy. Yeah.
Analogy. Yeah. Yes, I love it. Yes. Because you can't see there's no visible signs of anything being wrong. It's a software problem. Well, let's talk more about the software problem. So tell us more. What can we do?
So you've got this powerful connection, but if that was it, that wouldn't be enough for IBS. So what you also have is something called hypervigilance. And this is usually something that happens unconsciously, but the brain is always scanning the gut. And if anyone who's experienced, has had IBS, they understand this, that once you've had it for a little while, your brain is always checking to see how your stomach is feeling. How am I doing today? And then if it notices something that's a little off, then it starts catastrophizing. Like, oh, this is going to be a bad day. Maybe I shouldn't do the podcast with Jessie. I need to tell her that we need to put it off. Like I can't take that long car trip, or I can't go out to dinner, right? Because the brain starts just imagining all these scenarios where things could go wrong, right? So that combination of hypervigilance and catastrophizing, it creates all this stress and anxiety. And through that gut-brain connection, all of it goes down to the gut and actually starts causing symptoms. So in a way, it's kind of like a self-fulfilling prophecy.
Yeah, it's definitely a vicious cycle, right? And maybe having mild symptoms and then the hypersensitivity. So you're feeling all of it and your brain gets more anxious, or we get more anxious. And that anxiety makes our symptom worse. And it is a really difficult vicious cycle to break. Now, for IBS patients, I think this is a perfect place to move into our second topic. When is a good time? Like if people notice that they have this vicious cycle, the anxiety driving symptoms, their symptoms getting worse and making their anxiety worse. When is the good time to say, hey, I probably need to see somebody to help me with my psychology, to help me with my GI disorders?
So one thing we should understand right at the beginning, and I think this is no offense to doctors, but I think a lot of gastroenterologists get this wrong. When they think of GI psych, they think of giving the patient someone to talk to. oh, like you've got IBS, maybe you need somebody to talk to. No, that's not what these patients need. Of course, all humans, we need someone to talk to. We need someone to listen to us, but that's not what's going to really help their IBS. So we're not acting as someone to talk to. There are specific, very focused techniques that we will teach the patient that will directly help with their symptoms, right? And so I know this isn't answering your question. So let me go back to your actual question is when to get that help? Well, I'm of the opinion, and some might disagree, but I think GI psych in a perfect world would be a part of every patient's treatment once you're diagnosed with IBS, right? Because we know, and the research shows that it is tremendously effective. And so why would you wait? Because almost 80% of people will reach their treatment goals using these techniques from GI psych. And this is based on like 40 years of research. So why would you want to wait? Like if you're diagnosed with IBS, if you know it's not Crohn's or colitis or something like that, if I had IBS, I'm going right to it and getting that help. Now, I'm probably also going to work with someone like you, right, to help me with diet, to calm things down so that while I'm getting the GI psych treatment, my symptoms won't be going crazy. But I think I would start right away.
Yeah, I love that you're saying that because again, oftentimes, dietitian or psychologists are not in the treatment picture when a patient talks to a gastroenterologist. Very
Yeah.
rarely they refer out, but getting help from both these two specialties is extremely helpful. We actually refer a lot of patients to your clinic, especially when they're very anxious. We know that it is
Yes.
affecting, their daily life. Then, maybe having another person join the care team will be extremely helpful. And another scenario we really love referring out to you guys is also when patients are very afraid of food. Because with
Yes.
GI disorders, that is, they come to us wanting to reintroduce more food, but they have so much fear sometimes that they can't even start the reintroduction process.
Right.
And again, I think if somebody has caught it earlier on and noticing the anxiety, the nervousness, and maybe even starting to develop an eating disorder or disordered eating, they should refer it out as soon as possible instead of waiting or letting the patient stay on this anxious cycle, right? This vicious cycle for prolonged periods because it can do a lot more harm. I agree with you. I think, add GI Psych onto your care team, like anybody else listening here, add to your care team as soon as possible. Maybe create some plans or even just getting an assessment can be tremendously helpful to see what, treatment may look like.
Yeah.
But yeah. Okay, well, now let's talk about treatment options, right? When it comes to GI Psych, I think maybe talk about two things. What does assessment look like? And what does treatment look like for different types of patients? Like, what are the options? Let's start with assessment.
So let's say we have a very straightforward case of just IBS. That's it. And there's no comorbid mental health concerns. There's no history of trauma. There's no other medical conditions. I'm saying all this because most of our patients are much more complex, right? But let's say we have this very straightforward, simple case, only IBS. We would assess for all these other conditions to make sure that they don't have them going on, anxiety disorders or depression or trauma. And then we'd look at the big picture. Do they have chronic pain? How's their life? Are there relationships? And if it's just IBS, no other things, then what does treatment look like? It looks like two different modalities that have been shown to be effective. And that is specific kind of cognitive behavioral therapy and specific types of clinical hypnosis. The CBT most people have heard of, and the idea is that it's not standard CBT. And this is where a lot of patients can get disappointed because their providers will say, oh, you have IBS. We've heard that CBT can be helpful, so go see a CBT practitioner. And so they go, they do it. And that practitioner doesn't know how to adapt CBT to help someone with IBS. And so they don't really get much benefit out of it. So that would be one. And then the other is clinical hypnosis. And I think most people maybe avoid that because what they know about hypnosis is just entertainment hypnosis. They understand the movies and the stage shows and mind control and magic. And what they don't know is clinical hypnosis, which is research based. They've been studying it again for like 40 years and is extremely effective and powerful tool for patients with IBS.
Mm-hmm. So two main tools, right? Cognitive behavioral therapy that is focused on the gut GI disorders, and then also gut-directed hypnotherapy.
Exactly.
Yes. Now, when working with psychologists in the GI field, how often, so after an assessment, do patients go into treatments right away in the second or the third session, or do you start treatment in the first session? What does it look like?
I would say, interestingly, what happens in the first is mainly assessment, but there's also psychoeducation. And I would say good psychoeducation is actually an intervention. Because once people begin to understand the nature of the problem, and they can see that it's this interaction through the gut-brain axis with hypervigilance and catastrophizing, and then there's this, and we didn't really talk about this, but there's this visceral hypersensitivity that is happening that creates this nasty feedback loop that really can make people miserable. Once they understand that actually demystifies, they understand what's happening to them, and that actually makes people feel better once they understand. So I think treatment starts the minute we start doing education, right? And then the second session is usually when we get started. And those sessions are typically like a mixture of cognitive behavioral therapy and clinical hypnosis. And usually there's some homework from the cognitive behavioral therapy, and they'll make a recording for the hypnosis for the patient to listen to between sessions. And usually sessions are once a week. And the good news is the course of treatment is not very long. We're talking about between 8 to 12 sessions. So maybe around 3 months or so, someone could be done with treatment, right?
That's wonderful. And as they are working on different tools, right? Cognitive behavioral therapy, these are thinking processes to help them get out of the negative feedback loop. Is that correct?
That's part of it. And the other part is there's often a lot of avoidance happening in patients with IBS. So you spoke about food avoidance, right? And so that actually, avoiding these foods actually works to maintain the anxiety about foods. And so there often needs to be this structured program of exposure that is paired with reframing negative thoughts. But then there's also other types of avoidance. There's avoidance of situations and places. Some people don't go on long car rides. They don't, travel by plane. Like there's a lot of things they end up avoiding, right? That make their lives very limited. So working on that avoidance. And then finally, there's something called interoceptive avoidance. So meaning they begin to become anxious about their own internal bodily feelings. And that also adds to that anxiety spiral. So these are the levels of avoidance that we work on, as well as the negative thinking that you were talking about.
Oh, wow. That is amazing. And these are giving patients the tools so that when they're in certain situations, they can pull the tools out and not be afraid of it. And of course, right, every time I think we hear this from patients when they talk about food is, I go out to eat, I don't have symptoms. That really builds to the confidence. And you're talking about situations, it's the same things. Once you created the tool, they know how to use it. They go out into adventures that they might have been afraid of. Every time they do it again, it builds up to the confidence that I'm actually okay. I can do this again. I can do this freely. And then after a few times, their confidence really comes back.
And that's why you see with patients that have completed treatment's done, let's say here, their progress actually continues to improve. Versus if they're taking a drug they finish treatment, boom, and
Hmm.
they kind of collapse. And the reason it improves is because they've learned skills, they've learned self-hypnosis, they've learned how to identify and challenge their negative thinking, they learned how to challenge that avoidance in a structured way, right? These are all things they learn in treatment, and they can take them with them for the rest of their life.
I love that. Yes. It is so helpful. And it sounds like we all should go and see a psychologist right away for everything in life. But no, we are talking about specifically GI
Yeah,
disorders, gastrointestinal disorder treatments that is very specific for patients with GI disorders.
yeah,
Oh, that's
absolutely.
amazing. Okay. So thank you for sharing that with us. Like when to seek GI psych, we think go right away as soon as you've been diagnosed because nothing else is quite wrong. So let's work on the software and see if we can get you to a better place.
Yeah,
Now, last but not least, can you share 3 actionable steps for our listeners? So
yeah.
actionable items that they can do right now so that they can start feeling better.
I think the first step would be get really educated and really understand, and get your education from reputable places, right?
Yes,
So go to
absolutely.
Jesse's website, check things out. Go to our website, gipsychology.com. You know Megan Reel, Dr. Reel.
I see the book behind
Oh,
you.
yeah, yeah, yeah.
Yes, and mine copy is right here too.
Perfect. Yes. Yeah, read this book,
Hmm.
um, get get really into it, understand the problem, because the more you understand this problem, the less scary it becomes. The other thing then is I would recommend some sort of practice that
Hmm.
does some kind of affect regulation. So what do I mean? That calms you down, that teaches you a skill to reduce anxiety when you need it. So you can learn breathing techniques. You can learn what's called progressive muscle relaxation. There's visualization techniques. There's various things out there that you can learn that can calm yourself down. But just
Hmm.
realize you need to practice. You can't just do it once and say, "Oh, I know how to do that." No, this is a physical skill. You got to practice, right? So
Hmm.
that would be number
Yes,
2. And then the last one would be begin to understand your own thinking. Begin to kind of identify this hypervigilance and this catastrophic thinking, because I'm like everybody else. I'm I'm kind of focused on what I'm doing in the day. I'm not thinking about my own thinking. Most people don't do that, and that's normal, but if you want to change the way you're thinking, then you need to become more aware of it. And so you could do something like keeping a journal, or even like a little log. And anytime you feel anxious, just write down your thinking. You could do what's called mindfulness meditation, where you just kind of sit with your thoughts and just observe them. There's a lot of different things that you can do, but the third is doing something to become more aware of your thinking patterns.
I love that. Just what you were just saying, mindfulness exercise, right? Sitting there and just kind of
Yeah,
understand your thoughts. I think that can be really, really helpful for patients with IBS, right?
yeah,
When they feel the cramp, they immediately think a lot of the times like, okay, is this an emergency? Do I need to run now? Or
right.
maybe stay with it and breathe, deep breathe,
Just breathe.
take a few deep breaths
Yeah.
and feel it and see how you actually feel, right?
Yes. Yes.
Yes, and I love what you
Beautiful.
were saying, the 3 things that you actually just shared. One is the deep diaphragmatic breathing, do some deep breaths. Number 2 is progressive muscle relaxation techniques. And the third is visualization relaxation.
Oh, the
What?
3 things you can do to
Yeah,
calm yourself down. Yeah,
yes.
yeah, yeah, yeah.
Can you say the last one again?
Well, so there are 3 categories,
Yeah.
right? So it's the first is at getting good education. The second is
Mm-hmm.
an affect regulation technique, and
Mm-hmm.
those can include diaphragmatic breathing. It could include progressive muscle relaxation. It could include visualization. It could. There's various types of like other meditation and things like that. But
Yes.
anything that can shift your nervous system from fight or flight to rest and digest, right?
Yes,
Like
absolutely.
calm things down. And then the third would be doing things to help you understand your own thinking patterns, right? So when you get that cramp, now realizing, oh, listen to the thoughts that I have when I have the cramp. Wow, like they're really catastrophic, right? They're really like, oh my God, I'm gonna have to cancel everything, like, or I need to start sprinting to the bathroom right away. Like take a pause and just notice the way you're thinking can be incredibly helpful.
Yeah, I love these. All three things. Well, the three big picture things,
Yeah,
right? And
yeah,
then three actionable items that they can do right
yeah.
away is, and to truly understand, well, first to calm the body down and then also to better understand your thinking process.
Yeah.
Oh, I love this. I love this. Well, thank you so much for joining me today. Do you have any words, any last words that you want to share with our IBS listeners who might be struggling with their pain, with
Yeah.
their changes in bowel habits? What would you say to them?
Over the years, I've heard patients tell me about the messages they've kind of received from their doctors and other medical professionals that are along the lines of basically learn to live with it.
Mm,
And one of my messages I think I like to leave people with is you don't have to live with it. There are very effective things that you can do on the diet side of things. There's very effective things that you can do on the mind body side of things. These are not, just things we're telling you. These are things that have very good research and
mhm.
are effective. And so you don't have to live with it. There's a lot that you can do to make this better.
I love that. Thank you so much. Yes, there's a lot of evidence into diet therapies and psychological therapies for patients with IBS and GI disorders in general. However, they are not always recommended as one of the treatment options. But if you're listening, you know that these are options that can be extremely helpful in giving you tools to manage your symptoms, preventing symptoms, and maybe get you out of the vicious cycle. Well, thank you so much, Dr. Ali Navidi. Thank you for sharing all of your wisdom with our listeners, and I'm sure everyone appreciates it and finds it really helpful.
Thank you so much, Jesse. It was a pleasure.
Thank you for tuning into the IBS Nutrition Podcast. We hope today's episode has brought you closer to understanding and managing IBS. Remember, you are not alone on this journey, and finding freedom is possible. For more on IBS, make sure to follow us on your favorite podcast platforms and please leave us a 5-star review. We would really appreciate that. You can access links mentioned in this episode in the show notes to learn more about your type of IBS and how to identify your own food or lifestyle triggers. Register for our free IBS Masterclass, 3 Steps to IBS Relief, for our proven holistic 3-steps approach to managing IBS once and for all. Head to ibsdietitian.com/masterclass to register. Until next time, take good care of your gut, and here's to your health and happiness.